What qualities should that MBBS student have in itself to actually excel in this field?
You are basically a physician for the surgeon and a surgeon for the physician. It's a branch in between. And people who are confused what to do, most of the students, I also used to feel anesthesia is a non-clinical branch, which is the biggest myth about anesthesia.
In prospects of jobs and everything, is very saturated in top tier cities, Delhi, Mumbai.
If you're thinking that, you'll get more jobs initially in tier 2 and then I'll come to tier 1, slightly difficult, sir, because other people are already there.
So how should they actually judge the college, an institute, the hospital?
So preference should be given to all the big cities, all the hospitals present in big cities, because
Pros and cons of anesthesia.
the pros of anesthesia is that it's easy settlement initially. The biggest negative point about anesthesia is that
Do you think AI will be a big part of anesthesia in next 10 years? How much does an anesthesiologist earn? We are on a mission to build India's largest community of medicos. And yes, I need your help. I need your help to make this mission a possibility. So guys, to make this mission a success, I need you to subscribe to my channel right now. We are going to invite brilliant doctors of our country to come here and share their knowledge with us. And I'm telling you, every bit would make India better. So together, we are going to make this a possibility. So today, on your special request, I have invited a very special guest to discuss about the non-glamorous branch, the branch with so many myths, the branch which some people consider paramedical. Yes, I'm talking about anesthesia. So we are going to discuss how much an anesthesiologist can earn. What are the myths about anesthesia? Is anesthesia really a clinical branch? Is anesthesia as non-glamorous as we think of? Discussing and breaking all the myths today with Dr. Vinish Srivastava. He is a practicing anesthesiologist. He is the additional HOD at La Femme GK, specialist in critical care and obstetric anesthesia. He is a DNB anesthesia and he is going to help us break anesthesia to little bits. So let's put our hands together and with a huge round of applause, let's invite Dr. Vinish Srivastava. Welcome, Dr. Vinish, to our show. Thank you so much for taking out time.
Thank you, Dr. Nachiket, sir. It's an honor and a privilege for me to be a part of this show. Thank you so much.
Thank you so much, sir. So you are an experienced faculty of almost more than 15 years now. You have been a practicing anesthesiologist. So before we move on to your, enlightened life, I would like to know the beginning. How did Dr. Vinish Srivastava move on to be such a great personality?
So first of all, I would say medical was not my top priority as a field itself. I am the time, it's been almost 20 years now, anesthesia. So my priority was more, we have grown on the movies like Top Gun. So I'm more like a fighter pilot. So I cleared my NDA exam. My point was to join the Air Force, but medical was all, which was not there, medical tests through that. And finally, I joined the MBBS. This was my second option. I was good with maths as well as, bio. Both the subjects were there in my 12th standard. And then I took up biology after that and I took medicine. So I picked up medicine, but this was not the first choice per se. I would have preferred to go to NDA. So what happens is once I joined MBBS, and that was in Bombay. My studies have all happened in Bombay, Mumbai. So MBBS time, when I joined, the point was 5.5 years, an internship. I was someone who was very keen the extracurricular part as well. So I play the guitar. I've been part of fashion shows in my college. Also, I've learned dancing. I'm trained salsa dancer. So a lot of things were there apart from studies. So according to me, which branch I wanted to choose for my PG is something which I was not sure of, as most of the students are there. So from listening to hear and say from people, I thought the only branches that matter to us is medicine and surgery. And I got an option to do DTCD. So I'm a qualified chest physician also. So I did that from Lokmanya Tilak Municipal Medical College, Sion Hospital, Mumbai. I did that. And then I realized that OPD is not my calling. I still finished it and took up anesthesia after that. So in Mumbai, I finished off my diploma in FCPS. And then I thought that diploma is still a diploma. I wanted to do my DNB. And for that, I came to Delhi. And since then, Delhi has been welcoming to me. And it's been so many years. Now I'm settled in Delhi now. So that was my journey from going forward. So apart from doing MBBS, I've also done my hospital administration, my respiratory medicine diploma. I did my diploma anesthesia, FCPS and DNB anesthesia. And then practicing anesthesia now.
And you are a superb guitarist.
Superb, nahi sir, but yes, a little bit. It's my interest, it's my hobby. I like it.
Sir, I'll ask you a very basic question now. Why anesthesia?
So why anesthesia? So this is one thing. Anesthesia, in fact, when I was getting chest medicine, that time I was getting anesthesia also, but I choose to leave anesthesia. As most of the students, I also used to feel anesthesia as a non-clinical branch, which is the biggest myth about anesthesia. It's as clinical branch as any other subject. But this is hear and say from what our seniors tell us. So I felt anesthesia is not my calling and medicine is what, and didn't have a surgery bent of mine. So I picked up respiratory medicine and I was quite happy doing that. So, and Bombay Sion Hospital is very, very busy. So I was enjoying everything. But at the same time, somehow or the other, the OPD is something which I didn't like. I used to like the ICU work which was there. And thanks to my head of the department then, his suggestion was, you are more suited for anesthesia. Why don't you try that? Because you don't seem to be so keen on the, the respiratory medicine part, the sleep lab, about the PFT training and the OPD. I wasn't very keen on that. But yes, I used to be good with the procedures that we were doing in the ICU, with all the procedures. So I picked up anesthesia after that. I'll rather say it was not by choice initially, but just because of my head of the department from chest medicine who told me that, this may be one of the branches that may be your calling, why I picked up. And now I'm practicing anesthesiologist. I don't practice chest medicine.
Boss, for our students who are now looking up to anesthesia as a branch for their life, how would you describe the pros and cons of anesthesia?
Pros and cons. So let's start with the pros and then we'll go to the cons. The pros of anesthesia is that it's easy settlement initially. You will, as soon as you finish your post-graduation, you will get a call from some hospital, you will get a job. There are plenty jobs available, not just in India, even abroad. Second thing is your early investment is not needed. You don't need to invest anything. You have your degree, you are qualified well enough and you can practice anywhere in the country, anywhere you want to go. Third thing is that if you have passion, apart from studies, apart from practicing, apart from duties, you get time for that. So that is the third thing which I will say. The fourth thing is anesthesia per se provides you a very satisfying experience in terms of, dealing with the patients. Like the patient has come with pain, you give the medicine, you put the patient off to sleep, and then the surgery is over and the patient's pain is now relieved. Patient gets up after the surgery. You feel as a part of the procedure where you have taken care of, the patient's pain and he's becoming better and normal. So you feel a part of that also. So these are 4-5 points I feel which are the pros of anesthesia. And of course, if in case you want to do super specialty, there are always options available for further studies as well. The cons, the biggest negative point about anesthesia is that the myth that it is considered non-clinical, which even I used to feel. But how can this subject be non-clinical where the first day of your study, first day of your post-graduation, you join the OT and you're giving spinals and intubation from the first day itself? So if you're doing a procedure on the patient, it means it's as clinical as any other branch. So therefore, this is the biggest myth about anesthesia, that it is a non-clinical or a paraclinical branch. It is an absolutely clinical branch. This is a con which most of the people think, which actually is not a con. The reason why a lot of people don't choose anesthesia is because they feel we don't have patient interaction. Now, by saying patient interaction, I would say that it's more about, the OPD practice. So here you don't have an OPD practice. The patient doesn't keep on coming to you again and again. So that is one thing which people might feel that, it's a negative thing that, the patient doesn't come back to you. For example, you've operated a patient after surgery. So he will come after 5 days or 7 days and show you again. So like the patient knows you as a surgeon, as an obstetrician. For a medicine person, the patient not feeling well, cold and cough or whatever be the treatment, he'll again come and show you. In anesthesia, they'll not come again and again कि सर मेरे को आज बेहोश कर दो. ये वाली बात नहीं होती है कि सर मुझे ना फिर से बेहोश होना है. So no one does that. So your patient interaction is one negative thing. Third thing is validation from the patient's relatives. That anyone will say that, this surgeon, X and XY surgeon is very good. The obstetrician is very good. Go to this physician, he's very nice. Neurologist, cardiologist, cardiac surgeon. So they kind of get a name for themselves. In terms of anesthesia, no one will ever say, please go to this doctor. He's the very good one who can, put you to sleep. ये अच्छा बेहोश करता है. अरे बेहोश सब करते हैं. पर ये ना normally नहीं सुनने को मिलेगा कि हाँ ये बहुत अच्छा बेहोश करता है. So that is one thing is again negative about anesthesia, where you feel the patient's relatives validation, the patient's validation is slightly missing. The patient interaction in terms of the patient's return into the OPD is missing. And at one point of time, a lot of people might feel there is ceiling effect in the terms of earning. That एक level पे आने के बाद anesthesia में बहुत ज़्यादा growth in terms of money नहीं होता है. you will have to realize that you start earning early compared to your compatriots who were there in, surgery, medicine, other branches. You start earning early, but later on, a ceiling effect definitely hota hai. In a profession like surgery and obs and gynae, maybe that ceiling is not there. Because once you become a little older, a little more mature, with more skill, more experience, you will kind of get more money. So that is one thing which I will say. So these are the cons and the pros, as I said before.
So do you think that due to this lack of validation, anesthesia is not glamorized, and people normally tend to choose it as their second or third choice, third preference? I don't think so people have the first choice as anesthesia for their PG. Do you think it happens?
True, sir. Absolutely true, sir. Take my example. My example myself, me myself is that example for that who never thought of picking up anesthesia. So yes, that is definitely runs, and it's also because of this. And sir, one more thing, you will not find anyone from anesthesia telling a student don't pick up anesthesia. If you think about it, a lot of time you must have heard, some surgeon saying, oh, don't pick up surgery. There's nothing in surgery now. Someone doing medicine might still say, unless until you do your DM, don't pick it up. It doesn't make sense. So someone from other branches keep on saying ENT and ophthalm, people might just say, it's kind of getting saturated. Derma is getting saturated. You must have never heard anyone from anesthesia say, don't pick up anesthesia. So yes, it falls one of the, later, initially, it's not one of the preferences of any student. And I told you the reasons, the same, the cons, where you feel patient interaction is missing, or patient आपके पास नहीं आ रहा है, और आपको patient से validation नहीं मिल रहा. So this is one thing which you feel. And that is why it falls down to the second or third option right now. If people, they don't get surgery, they don't get medicine, maybe they don't get any other branch, and then they fall down to anesthesia. But sir, a recent trend I have seen, my attending and associate consultants who are working with me in my hospital also. So these people have opted anesthesia by choice, especially the ones who are keen on critical care, ICU part, and who've kind of understood anesthesia. So I know few people now. Now I'm seeing that change in the trend that people are picking up anesthesia. But yes, still it is second or third and not the first branch. For example, when we say about obs, gynae or surgery or medicine or orthopedics.
How's the work-life balance in anesthesia?
So it depends as to how you want to do it. In the sense that in case you're in, normally anesthesia has fixed hours. Always some emergency duty is going to be there. I'm not denying that. But let's leave freelancing apart, because in freelancing, you don't get time. Freelancing is something where you're not attached to any hospital. You're going to this is very common in Mumbai, Bombay and all. Less common in Delhi. Freelancing is there in Delhi, but less. Bombay, it's very common. So in that case, you have to be readily available when a surgeon is calling you. Okay, one more point, sir. So a lot of people feel it's a dependent branch, which I was speaking about the cons, right? So a lot of people say it's a dependent branch, but there they forget that, anesthesia, if anesthesia person is dependent on the surgeon, similarly, the surgeon is also dependent on the anesthesia person. Anesthesia ke bina surgery kaise karega wo?
True.
So it's not a dependent branch, again, which was a con as most of the people think about it. So work-life balance mein, I feel that leave the freelancing aside, but in government as well as in private, you get sufficient till the time you're on duty. You're on duty, sir. And once you're off, उसके बाद आपको कोई डिस्टर्ब रूटीनली नहीं करता, तो आपको अच्छा कंफर्टेबल टाइम मिल जाता है. सो यू गेट, इन केस एनीवन हैज हॉबीज, पैशंस अपार्ट फ्रॉम वर्किंग, एज आई सेड बिफोर, यू गेट sufficient time for that. So work-life balance is very well maintained with anesthesia. But as I said, the biggest negative con that you will feel in some time of your life is that you might feel it as a ceiling effect. Later on, when you become older, in the initial part, you're earning very well. But later, when you become older, that ceiling effect might still bother you that, my people along with me in surgery and gynae are doing much better in terms of earning. But yes, you need to remember that you started before them. You started earning well before them. So that is what many people forget. Apart from that, I feel it has got a good work-life balance. You get good time for yourself.
What are the super specialty possibilities and opportunities in anesthesia?
So super specialty is how to now come up in a big way. Transplant anesthesia is big. It needs precise, you need to be proper trained for doing transplant anesthesia. Similarly, for cardiac and neuro anesthesia, you need to be trained, which have fellowships and all. Critical care, another thing, and pain management. So all these are super specialties of anesthesia. In fact, sir, everything is a super specialty. Like the hospital that I am working with presently, it's more catering to that obstetric part where we do more of labor analgesia and all. So that becomes obstetric kind of a thing. So you have pediatric, obstetric, so all those kinds of specialties are available. So there are fellowships also, and there is DM also. But if you talk about DM, it's more about critical care and cardiac and neuro anesthesia, and fellowships in transplant and pain management. So there are the super specialty opportunities which you get from anesthesia.
Most you have done diploma in anesthesia. You have done DNB in anesthesia. How would you say, what is the equivalency between MD, DNB and DA? And Are they actually equal, or is there any difference between all the three branches?
Okay, let's talk. DNB can be of two types. One is primary and secondary. So what I have done is a DNB secondary. So I did my diploma, which was 2 years, and then I did my DNB secondary, which was 2 years. So this was a separate part. But let's leave the secondary DNB aside. So secondary DNB is after the diploma which you do. We'll just speak about plain diploma, plain MD and plain DNB. So a diploma course is a 2-year course. MD and DNB are normally 3-year courses. So basic difference between diploma and MD and DNB is that in diploma, you're not doing research. You're not doing the thesis. But in MD and DNB, you do thesis. There's a research work that you're undergoing. So you need to submit your thesis. So you learn that part of the teaching also. That part of it's a part of the curriculum, which is not as a part of diploma. Plus diploma is a 2-year course. Yes, you learn things in your 2-year. And still I feel, but it's always better that, you are MD or DNB qualified. Because when you're working, a diploma is always considered little substandard compared to MD and DNB. MD and DNB are considered equivalent. No problems with that. Once you've cleared your DNB, it is good enough. It's equivalent. But diploma is always considered a par lower. And this can happen in terms of earning also. And in terms of, the way the people treat, someone who's just a plain diploma holder compared to someone who's MD or DNB cleared. So that is one basic thing which I feel is a difference between them. So all the people I tell who have done diploma should either go for DNB or an MD again after that. Of course, you're well qualified with diploma also, but DNB or MD will complete you. So you should be doing that.
Where do you see this branch in upcoming 10 years?
So I still feel anesthesia has a lot to be, a lot has to be done, and vacancies are going to be there, because if you will calculate the number of surgeons passing out from an institute, let's take just a surgeon now. So if you take super specialty from them, so surgery, cardiac surgery, neurosurgery, plastic surgery, pediatric surgery. So this is the surgical branches. Obstetric and gynec, ENT and ophthal. And apart from that, all these branches, orthopedics. So when you see all these surgical branches where people are operating, and compared to the number of anesthesia people clearing out, the number of anesthesia people are always less compared to the number of surgeons passing out at any given point of time from any institute. So, sir, always that negative balance is there in terms that anesthesia people are always in short. And not just in India, even abroad. Vacancies for anesthesia there abroad as well. So there's always a shortage of people. And I feel again, for even 10 years down the line, there's not going to be saturation as what we say in some other branches. Yes, when you're settled in a city, the kind of, maybe the options might be limited, if you want to settle in a main city like Mumbai or in Delhi. But if you go to a little bit periphery, there's a dearth of anesthesia people, sir. Absolutely. There's so many villages or, towns where you will not have good anesthesia people or not people trained so much in anesthesia. In fact, a lot of places I know in villages, they have to wait. Emergencies have to wait because anesthesia people are not available. And in fact, one of my juniors, I even remember, he comes from a very far off place. So I remember he's a pediatrician, but he has been trained in he's a medical officer appointed by the government at one place, but he has been trained in such a way that he can give spinal also, because there is no anesthesia person available in that district hospital. So he's someone who gives spinal and then he handles the pediatric babies. So something of that sort. So I still feel that the branch is not saturated as yet. So you have options available to you even in the future.
Boss, do you think in next 5 to 10 years, super specialty will be a compulsion in this field?
Super specialty will be a compulsion? I don't think so, because general anesthesia is always needed. But when it comes to super specialty branches, yes, you will need the super specialist. For example, transplant. In a transplant, anesthesia involves a lot of other things apart from normal anesthesia. So you have to be particularly trained with that. Similarly, with neuro and cardiac anesthesia, you have to be trained. So even if you have done your MD or DNB, unless and until you do your fellowships, you're not well versed with that cardiac surgery, continuously, or with the transplant surgery. So in these specialty branches, you will need to be having your super specialty degree from anesthesia, fellowship from anesthesia also.
In the next 10 years, which super specialty in anesthesia do you think will have the maximum potential?
Transplant.
Hands-on.
Transplant. I feel so. That's my transplant and critical care. Critical care is always going to be in demand, critical care, and even transplant anesthesia, I think, according to me. So everyone might have their own opinion, but ye mera opinion hai.
All right. Can you name 5 top institutes for MD anesthesia in our country?
When we speak about MD, the normal central institutes is what I will always recommend. If someone says which place AIMS always stands out, yes, it's also to do with the quality of teaching. It's not about just the exposure and the work you're doing. It's because of the professors who are there, the people who are teaching over there. And trust me, these institutes have a name because they have maintained those standards. The teachers have maintained those standards. So whether it is AIMS, PGI Chandigarh, the Central Institutes, Maulana Azad Medical College, I'll count that as well, or any institute in Delhi. Jipmer also I can take, one of the names. And then Mumbai, because I am from Mumbai, I've got a soft corner for that also. So I'll always include KEM and Grant Medical College as part of it.
Top 5 institutes for DNB anesthesia in our country.
Right. So again, for DNB, I would say preferring a government hospital is better. Now, what happens in DNB is that if you're working, DNB normally is given to private institutes. Like for example, in Delhi also, a lot of private hospitals, they have DNB seats. If you speak about surgical branches, in those branches, DNB students might not be getting a lot of work, the skill-based work, because, these are private patients and praying patients. But in anesthesia, you get well-trained even in the DNB institutes. And that's why a lot of students, instead of opting for diploma, pick up DNB in good cities in India, like students when they get options. So for DNB, I would say in Delhi, because hands-on I've seen good DNB institutes in Delhi. If you're working in government, you get free-hand exposure also. So something like Deen Dayal Upadhyay Hospital, which has DNB seats. Gangaram is good, Apollo is good. Fortis and Max also have seats. So because I'm based in Delhi, I'd rather put for DNB, Delhi seats as, good ones which are there for DNB.
Boss, you have seen anesthesia very closely. I mean, if a student wants to choose anesthesia, what qualities should that MBBS student have in itself to actually excel in this field?
So I feel the definition of anesthesia. What should be the definition of anesthesia? You are basically a physician for the surgeon and a surgeon for the physician. It's a branch in between. People who are not very keen that I want to pick up surgery. People who are not very keen that I want to do only medicine or OPD based branches. And people who are confused what to do, for them anesthesia is the best branch. Because if you are very much keen on operating, surgical field, you will never be happy with anesthesia. So I always tell students that if you feel that your calling is surgery, you are greatly keen on surgery. But nowadays, as I said, a lot of people feel that surgery, surgery options, you have to do your MCH and maybe don't pick up a surgical branch. I still feel that if you're keen on surgery, please pick up surgery, because you will never be happy with anesthesia. Anesthesia should be picked up by those people who really feel that, I'm out of place with all the branches. Like I don't like surgery also so much. I don't like medicine also so much. And I don't know what to do. So in that case, pick up anesthesia, you'll be happy.
Suppose if a student wants to take up anesthesia as for their PG residency, so how should they actually judge the college, an institute, the hospital? What are the parameters they need to keep in their mind?
So, sir, I feel in that case, they should think about which place they are planning to opt for the seat. Speak to the seniors over there. And because the seniors are the best people who will guide it. As I was saying that in government institutes, what happens is there may be some, less resources in terms of monitoring techniques, but you get good skill-based exposure. In private hospitals, everything is available. So I think whichever place you're opting for, I think you need to speak to the seniors over there. And of course, in central institutes, like in government and in big cities, you will get all the equipments and everything. So preference should be given to all the big cities, all the hospitals present in big cities, because there'll not be lack of monitoring techniques or lack of, instruments or things present over there, and good exposure in terms of critical care also. Maybe a smaller town or a smaller place would have less exposure in terms of critical care. That's my understanding.
So for an anesthesiologist, what are the potential opportunities abroad, outside India?
So there are opportunities available even today. As I said, there's always dearth of anesthesia people, because the number of surgeons or the skill-based people passing out, obstetricians and all, is always much more than the anesthesia people. So there are lots of opportunities available, especially in countries like UK, European countries, Australia. There's difficulty to go to the US and Canada because you have to give separate exams. But in fact, for UK, forget exams, you just have to apply over there and they'll take you. There's so much shortage of anesthesia people in the UK and European countries.
Actually, that's a very good news, I think, for our student itself.
Yes, sir. So a lot of people are not aware, because normally what happens is for UK, you just have to apply to the hospital. And if your job is secured, because there's shortage of people over there, and if the recruiter over there, if they can recruit you, so they get the GMC registration done for you. So based on your years of experience, of course, you have to be well experienced also and from a good institute. So you can go even without giving any exam. And then, of course, you can go and give FRC over there. But through the MTS scheme, which was there, people could go for 2 to 3 years directly and then kind of give an exam and settle in the UK.
What are the possible business opportunities in this field?
So more than business, I'd like to say that, anesthesia person can do management very well in terms of administration. Because this is a branch where you need to react very fast. You give medicines, हमने जैसे patient को बेहोश किया. All the medicines that I'm giving to the patient can kill the patient at any point of time. So if I'm unable to intubate, I need to do what to do next. If it's a difficult airway, I know इसके बाद आई जेल डालना है या इसको intubate करना है. Intubate नहीं करना है तो next क्या करना है. So I have to be prepared and I have to do a quick decision making, which makes you take decisions very fast. So I think administration jobs, you'll find a lot of anesthesia people in the administrative based jobs like medical superintendents, both in government as well in private hospitals. You'll find anesthesia people over there because they take quick decisions. So that is one point, sir. The business part, I feel what happens is anesthesia people, because they are exposed to all these specialities. So anesthesia people can set up their own hospital and have other people come with them. I have got my friends who have their own hospitals, and then they can call in the surgeons, the obstetricians, have OPD placed, and you are the one who's administrating the hospital that way.
So are we saying that anesthesiologists basically are the best people to run a hospital?
I would say so, sir. Because then they are not worried about getting the patients at that point of time or worried about the OPD. They're taking care of the critical care part and the ICU part and the OT part. So you get time maybe to manage other things also. तो उसके लिए भी टाइम मिल जाता है. आई फील सो दैट इज माई थिंकिंग. सर थोड़ा सा बायस्ड टुवर्ड्स माई ब्रांच ना. थोड़ा सा बायस्ड भी हूँ ना मैं.
All right. So we come to the most important question and the most demanded question of our podcast. How much does an anesthesiologist earn? And you have to tell us in detail about a fresher, basically an SR, a mid-level anesthesiologist, and a senior anesthesiologist. First tier city, second tier city, third tier city, corporate and government.
Big question, sir.
I know.
Lekin, let's see. I'll answer in such a way that when you see, first let's make a difference between north and south. In the sense that when you're working towards the southern part of the country, the pay is slightly less compared to the northern part. I'm not naming the states and all, but towards the southern part, it is slightly less compared to the northern part. So let me talk about Delhi, for which I've been based for a very long time. So when you are a SR in Delhi, senior resident, by the time you're doing SRship in a government institute, is around 1.2, 1.3 lakhs, 1.4. When you finish your SRship and you join as an attending consultant in a corporate in a big city like Delhi, you start with 1.5, 1.6, that is per month. And later on, you can go up to 2, 2.5, almost depending on what branch you're going. Maybe if you're going into cardiac anesthesia, neuro anesthesia, the salary will change. So this is about the SR. Another thing I would like to say is that whether you are the starting person or a mid-level or even at the senior anesthesiologist, as I said, there's going to be a ceiling effect. Most of the anesthesia people throughout the country with a routine job and ones who have time for themselves also would be earning anywhere between 2 to 5 lakhs. 5 would be the capping, I would say, as a ceiling. More than 5 is slightly difficult, even for a senior anesthesiologist, unless and until they're working in big corporate hospitals where it can go up to 8 to 10 lakhs. Big corporate hospitals in Mumbai and Delhi, it can go up to that much. But routine anesthesia people, routine places would be around 4 to 5 at the mid-level that they're doing. Also freelancing, when people are doing freelancing, in that there's again no limit. In Delhi as well as in Mumbai, people who have done freelancing can earn around 8 to 10 lakhs. That is there. But yeah, that was the points. And tier 2 and when it comes to tier 2 places, like in that case again से थोड़ा सा कम होता है. लेकिन we have to realize कि वहाँ पे anesthesia वाले भी कम होते हैं. So anesthesia, I would rather put it this way, is your pay will be equivalent to amount of work you're doing. अगर आप कम काम करोगे थोड़ा सा तो आपको कम पैसे मिलेंगे. आप ज़्यादा काम करोगे तो आपको ज़्यादा मिलेंगे. कोई भी ब्रांच में ही होता है. If you're doing surgery, you operate 2 patients in a day or maybe just 1, so you'll be earning less for that. You operate 10 patients in a day, you'll be doing more. So anesthesia people have this point that they can give spinals maybe to 10 people. But surgeon जो होता है एक साथ 10 सर्जरी करना मुश्किल होता है. Anesthesia वाला एक दिन में 10 स्पाइनल लगा सकता है, उससे भी ज़्यादा. So that's why you're earning in terms of, you start very early, as I was telling you. Even in tier 2 में क्या होता है कि your pay in a corporate will be restricted, but if you're doing the freelancing part, then the sky is the limit. So it depends as to how much time you're giving to the freelancing. For example, my friends who are there, वो 9 to 5 job कर रहे हैं. 9 to 5 they are working in the hospital. उसके बाद वो free हैं. So if they want to be free, then they are not going anywhere. But if they say no, I'm available for calls, तो कहीं भी कोई call आती है, emergency cesarean आता है, laparotomy होती है या कुछ भी होता है, they'll get a call. So if they go there, again they'll be earning for that. So this is your off time from the hospital where you've been working and getting fixed pay, and this is a second opportunity that you're getting. So you will be working in multiple hospitals. If you're working in private and corporate, you get options to work in multiple hospitals, and based on that, your pay can change. It can vary. But as I said, how much ever you will try, sir, maximum 4 to 5 is what I think. Ki anywhere in the country, 4 to 5 is the maximum you will reach at mid-level or maybe high level. You start with 1.5 to 2. 2 also आराम से शुरू हो जाते हैं. 2 to 5 के बीच में आपका सीलिंग चलता रहता है. That was the ceiling which I was talking about. उसके beyond जाना थोड़ा सा मुश्किल है.
So you were talking about myths in anesthesia. So myths about anesthesia actually. So you have told us a couple of myths. Can you just tell us more?
Myth में सर सबसे बड़ा वही है कि biggest point about the myth about anesthesia, biggest myth is that it is a non-clinical or a paraclinical branch. So I always tell the students, remember, it is the most clinical branch that you can get into. It is clinical. The second myth is that it's a very boring branch. It's not boring. It is boring initially because when students are coming into anesthesia, when they're working in the OT, they don't know what to do or what to expect. या हमारा काम क्या है? But once the responsibility of the patient has been given to you, that this patient you are going to handle, you are responsible. Sir, anesthesia ऐसा होता है ना कि आप किसी patient को मार दो, you are killing a patient and you are maintaining the vital parameters. That is anesthesia. So in that case, the responsibility of the patient rests on your shoulder. The heart rate, BP, everything about the patient depends on you. So once you become responsible, it doesn't feel boring anymore. Because then you're responsible for everything. A small change in heart rate and BP, you will be worried as to what has happened to the patient. अगर यूरिन आउटपुट नहीं आ रहा है पेशेंट का सर्जरी के बीच में, यू विल बी स्टार्टिंग थिंकिंग कि क्या हो रहा है. एंड दैट्स व्हाट आई सेड कि इट्स अ ब्रांच जहाँ पे आपको सर्जरी तो पता है, लेकिन यू हैव टू थिंक लाइक अ फिजिशियन कि हार्ट रेट बीपी क्यों चेंज हो रहा है, यूरिन आउटपुट क्यों नहीं आ रहा है. एंड दैट इज व्हेन इट बिकम्स चैलेंजिंग एंड यू हैव टू स्टार्ट थिंकिंग एंड वर्किंग ओवर इट.
Does the role of anesthesiologist, when I say role, I mean work-life balance, the role inside the hospital, change in a government and a corporate setting?
In terms of work तो सर चेंज नहीं होता because you're doing the same thing. But I'll say rather this thing, the higher you go up in a government institute, because anesthesia की seats इतनी होती हैं, like you'll find even senior surgeons operating. But anesthesia people are, as soon as you go higher and higher in a government institute, you'll be working less in the OT and will be doing more of administrative work in anesthesia in a government institute. और प्राइवेट में सर क्या होता है, you'll be still working. आप काम करते ही रहोगे. अगर एडमिनिस्ट्रेटिव जॉब होगा तब भी आप you'll be there in the OT, you'll be required, you'll be working. गवर्नमेंट में सर इतने एसआर्स होते हैं, इतने असिस्टेंट प्रोफेसर्स होंगे, इतने स्टूडेंट्स हो जाते हैं, दैट इट्स मोर ऑफ द एडमिनिस्ट्रेटिव पार्ट दैट द हेड और द वन हु इज एट द टॉप ऑफ एनेस्थीसिया वुड बी लुकिंग इनटू द एडमिनिस्ट्रेटिव पार्ट, लुकिंग इनटू द इम्प्लीमेंटेशन ऑफ पॉलिसीज. सो दैट इज व्हाट इज सीन इन गवर्नमेंट मोर.
I have heard a lot from students that anesthesia as a branch in prospects of jobs and everything is very saturated in top tier cities, Delhi, Mumbai. Now, is that part true?
A little bit might be true, because if anyone wants to work in the biggest hospitals, like the big names, so because they already have a lot of doctors associated with them, anesthesiologists associated with them, it is possible the time when you have got free, you are not getting a seat. Because it's already been there. The number of people would be fixed over there unless until someone from there leaves out. So yes, in big cities, this point may be there, especially if you're looking out to be working with those big names in the big cities. But अगर आप वहाँ पे नहीं काम करना चाहते हो या कहीं और करना चाहते हो, even in Delhi I'm saying, like someone who's done his or her MD or DNB from maybe a place outside Delhi and has come to Delhi the first day, he just meets few friends. Sir, trust me, उसको रात को कॉल आ जाएगा, आज ना क्रिटिकल केयर के लिए यहाँ पे नाइट ड्यूटी करनी है. So without anything, the first day itself, he'll get a call. Yes, it may not be that corporate hospital that you're looking out for. It may not be the place that you want to be associated with. But definitely you will get a call. मतलब कोई ना कोई job तो आपको मिल जाएगा. ऐसा नहीं है कि आप first day भी without काम बैठे रहोगे. You will get your job. You will get a call from somewhere. You just have to find that link and tell that I'm a qualified anesthesiologist and I'm just looking for a job. कोई ना कोई critical care में ICU में आपको बुला लेगा, कोई ना कोई emergency duty पे बुला लेगा, किसी का locum करने के लिए बुला लेंगे. It's not about Delhi, it's about everywhere in India. Someone comes to know you're from anesthesia, आपको job sir मिल जाएगा. Yes, as you said, saturated का जो part है, that happens more with those big hospitals, the big corporate names, where जब vacancy होती है तभी आपको लेंगे, उसके बिना you just can't join straight away over there.
So if I just, add on to this, if a fresher wants to start his journey, so for better job prospects, should they start from tier 2, tier 3 cities, or should they actually try and come to tier 1 cities?
Good question, sir. I'll say start at the place that you want to be. Because your experience in the tier 2 cities is not going to help so much in this place. So for example, in my hospital where I was, after I moved out of Maulana Azad Medical College and I joined this place that I was in, so I worked 8 years as senior consultant. But then these people are knowing that I've been working in the same place. I didn't change my hospital. And then they made me the head. So in that case, they are looking at you as to what work you've been doing, whether you've been trained in the same manner or not, and whether you can handle the department or not. So I'd always say that, try to stick. Of course, people change the jobs also. But if you're working, if you're thinking that, you'll get more jobs initially in tier 2 and then I'll come to tier 1, slightly difficult, sir, because other people are already there. You have a lateral entry point. नॉर्मली क्या होता है, वर्टिकल होगा, जो नीचे होगा वो ऊपर 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 जाता रहेगा. बट कमिंग फ्रॉम अ टियर 2 सिटी मीन्स यू विल कम फ्रॉम द लैटरल एंट्री एंड यू वांट टू गो टू द टॉप, व्हिच मे बी स्लाइटली डिफिकल्ट.
In terms of job prospects, adding on to this, outside the operating room and the administrative part, is there any job possibilities for an anesthesiologist?
Yes, sir, it is. First thing is that anesthesia people are needed on all the CT scan and MRI centers, which we are not aware. Anesthesia without all the CT scan and MRI centers have mandatory anesthesia person to be prepared. Because sir, we know MRI जैसे करना होता है, तो if a pediatric patient is there or someone with a movement disorder, तो उसको तो सर बेहोश करके एनेस्थीसिया दे के तभी उसको MRI कराना पड़ता है. A pediatric patient is not going to get MRI done without that. So presence of anesthesiologist is needed there. Plus in terms of emergency, किसी को कोई reaction हो गया, immediately to see anesthesia is an emergency branch. You immediately intervene. अगर आपको CPR करना है, intubate करना है, so CT scan, MRI is one place. Even ophthalmic centers, sir. Ophthalm की all the surgeries are done under the blocks. बट स्टिल यू विल नीड एनेस्थीसिया पीपल. अगर पीडियाट्रिक पेशेंट है उसकी सर्जरी कैसे कराएंगे? पीडियाट्रिक स्क्विंट वेरी कॉमन, तो उसकी सर्जरी कैसे कराएंगे? तो यू विल हैव टू हैव एनेस्थीसिया पर्सन इन दीज ऑफ्थैल्मिक सेंटर्स ऑल्सो, ऑफ्थैल प्लेसेस. सो इवन इट्स ऑफ्थैल सेंटर यू विल बी देयर. CT scan, MRI यू आर गोइंग टू बी देयर. एनेस्थीसिया पीपल आर गुड विथ हैंडलिंग द इमरजेंसीज. दे आर नॉट स्केयर्ड ऑफ ब्रीदिंग डिफिकल्टी. लाइक फॉर एग्जाम्पल किसी को सांस में दिक्कत हो रही है, यू नो द नेक्स्ट स्टेप आई एम गोइंग टू डू गिव ऑक्सीजन. अगर उससे भी नहीं इंप्रूव हो रहा है तो आई ट्राई टू पुट CPAP, BiPAP, और नहीं इंप्रूव हो रहा है तो आई पुट एंडोट्रेकियल ट्यूब एंड पुट ऑन वेंटिलेटर. सो यू नॉट वरीड अबाउट द ब्रेथलेसनेस, यू नॉट वरीड अबाउट द कार्डियक पार्ट. सो एनेस्थीसिया पीपल बिकम गुड जनरल फिजिशियंस. I have a lot of my friends in Mumbai who are anesthesia people, but they also run their OPD clinics because as I said, इनको हमेशा ही लगता था कि हमारा OPD interaction नहीं हो रहा है. I am not getting a patient who's coming back to me. So some people have started their own clinics as a OPD normal, like general physician, and you can do that. होता क्या सर? They are not worried about any emergency because a normal MBBS or even a medicine person intubate करने के पहले लोग सोचते हैं because I have done respiratory medicine. I know. बिफोर इंटूबेशन इन रेस्पिरेटरी मेडिसिन यू वर थिंकिंग करना है या नहीं करना है. एनेस्थीसिया वालों का फर्स्ट डे से काम होता है हाउ टू इंटूबेट. सो यू आर नॉट वरीड अबाउट द ब्रेथलेसनेस. हमको पता है इंटूबेट करके हम उसको वेंटिलेटर पे डाल देंगे. सो यू आर गुड इन टर्म्स ऑफ हैंडलिंग द इमरजेंसीज.
Do you think AI will be a big part of anesthesia in next 10 years?
Yes, sir, I feel so. AI is going to change a lot of things. In anesthesia, especially in terms of monitoring techniques, I think it's going to be important in terms of that. In terms of drug delivery system, where accurate drugs have to be delivered. So these are 2-3 places, but still, I don't think it's going to impact so much in terms of that, job prospects for anesthesia people are going to make a difference. It would be more in terms of, helping the anesthesia people. Because ultimately, intubate तो खुद ही करना पड़ेगा, spinal खुद ही देना पड़ेगा, central line खुद ही डालना पड़ेगा. Nothing else, any amount of AI is not going to do CPR or, maybe it's difficult. According to me, now I can't envision something like that. कि कुछ AI के वजह से आप इंटूबेट कर रहे हो और AI से आप CPR कर रहे हो. बट येस, यूज ऑफ AI इन टर्म्स ऑफ टीचिंग एज अ टीचिंग टूल, इसमें तो बहुत इंप्रूवमेंट होगा. ड्रग डिलीवरी सिस्टम्स और मॉनिटरिंग टेक्निक्स, आई थिंक उसमें हेल्प होगा.
Do you think AI will eat up jobs?
सर मे बी इन अदर प्रोफेशंस में तो है, बट मेडिकल प्रोफेशन में आई फील बिकॉज यू आर वर्किंग. तो इवन सर जैसे कि लोग बोले थे रोबोटिक सर्जरी इज बीन देयर, बट रोबोटिक सर्जरी ऑल्सो ऑपरेट तो सर्जन ही करेगा ना. देयर हैज टू बी समवन हु इज ऑपरेटिंग इट. सो अल्टीमेटली मेडिकल जॉब्स आई थिंक इम्पैक्ट कम रहेगा, बट येस हेल्प हो जाएगा. आई थिंक AI विल हेल्प द मेडिकल फील्ड. दैट्स व्हाट आई फील.
What would be your advice to a new JR1 entering the field of anesthesia?
Someone who's just picked up the seat.
Yes.
I would just say कि observe your seniors, and I'll say that initially for the first 3 months, it would seem that you're in the worst profession possible because you will get into the OT, you will change your clothes, and after that you'll be just looking at the monitor. Someone else is going to be operating, and you'll be thinking कि मैं सुबह को 8:30 से लेके शाम को 5 बजे तक क्या कर रहा हूँ. Right? But you have to remember that after 2 or 3 months, when you realize what is happening in the OT is when you start getting things. You'll be giving spinal at one place, and once you're giving spinal anesthesia, you'll be bothered कि hypotension नहीं हो, patient कुछ और problem नहीं हो. You'll be taking care to prevent complications. When you join the first 3 months, you're not worried about it. आपके साथ कोई और बैठा हुआ है. The point is कि after 2 or 3 months, when you start, getting the hang of things, you are being responsible for it. This is the time when you start learning anesthesia. So have patience. According to me, be patient, you will learn and you will enjoy the field. On a lighter note, सर कौन सा ऐसा ब्रांच है जिसमें आप सुबह सुबह हॉस्पिटल जाओ, स्क्रब्स में चेंज करो, कुर्ता पजामा पहन लो और उसके बाद पेशेंट को ईथर क्लोरोफॉर्म के डेरिवेटिव सुंघाओ और चाहिए तो खुद भी थोड़ा सा ले लो? विच ब्रांच यू विल एवर गेट दैट? ठीक है, तो दैट इज द काइंड ऑफ ब्रांच यू आर गेटिंग इनटू. Right? So the first thing that you're doing is that just have patience for yourself. Just have patience. Be patient about it. Yes. And sir, ऐसा भी होता है कि this is where a lot of people do realize when they're meant for anesthesia or not. This is an example I'm giving you. One of my juniors from Grant Medical College, he picked up anesthesia by choice, MD. बहुत अच्छा स्टूडेंट था सर. अभी दिल्ली में ऑर्थोपेडिक सर्जन है वो, लेकिन ही वॉज कीन ऑन ऑर्थोपेडिक्स. all of us, he was a junior, all of us forced him to leave the anesthesia seat because he was so good with the orthopedic part, and he picked up orthopedics after that, and he's doing very good. So I would advise all the students, pick up the branch only if you are interested. If you're keen and if you think you have a surgical bent of mind, please don't pick up anesthesia. You will be absolutely bored, and then you are the one who will tell all your juniors, don't pick up this branch. Otherwise, बाकी सब लोग यही बोलेंगे कि yes, anesthesia pick up कर लो, अच्छी branch है.
So boss, you are working in La Femme GK. I think you have gone through a lot of celebrity patients.
So celebrities तो आते हैं. बात तो सही है.
So can you name us few?
Sir, नाम लेना थोड़ा सा, but I'll rather put it this way. Let me not take the names, but I'll put it this way that I have given anesthesia right from politicians to film stars and to cricketers, right? So it's more to do with the female patients. So all of them. So it covers all the whole spectrum of it. ठीक है sir, all the spectrum of it. The hospital is such, but I feel, see, patients are patients, sir. And बेचारे वो भी वहाँ पे सफ़र भी कर रहे हैं या they are for their pain relief. So sir, it's something of that sort, but yes, we have handled.
Sir, with this we come to the end of our conversation. I think it was a very compelling one, anesthesia through and through. I don't think so any student of ours would be having any confusion about anesthesia anymore. But guys, it's the rapid fire round time, so please do not go anywhere. We are going to ask some very interesting questions to Dr. Vinish here. So Dr. Vinish, the rapid fire round is here. Just two very important rules. You have to speak the truth, and second, you have to be super spontaneous. No thinking. The most rewarding moment in your career so far?
Sir, it has been many a times that, you get to save patients' lives. You're doing CPR and someone has got revived. But more than everything, I'll say there was one patient in our hospital, and this patient came with ruptured ectopic with blood pressure of 60/40, which is almost kind of gone. And she was expecting that she will not survive. The whole family was expecting they'll not survive. And we induced the case, started, she got well. And maybe, sir, for years and years, she remembered that, and her family remembered that, I was the anesthesia person on duty. They kept on sending, the mails, they kept on sending greeting cards saying that, we are still, thanks to you that day. So, of course, nothing that we did, we just did a job. God is the one who's a savior. But yes, sir, that point and that patient is something which I cannot forget.
What's the one thing you never leave home without?
Sir, mobile. Anesthesia person, it has to be the mobile. Sir, mobile देखना पड़ेगा, patient induce किया, उसके बाद खेलना भी तो है. We have to play also.
Topmost celebrity you have ever treated. Give me an impression.
Okay, so someone that you think is someone related to one of the superstars of the country.
Which one?
Sir, नाम नहीं लेना
Give me an impression, na? You are good in impression, I know that. Give me an impression.
I'd rather put it this way, something that everyone in India and even abroad knows. Someone related to that.
No, that can be anyone. But still, give us an impression. Give us an impression.
Sir, बस नाम बोल दो और समझ जाएंगे लोग.
Give us an impression.
So, the superstar of the country presently. Yes. I'll not say more.
If not an anesthesiologist, who would Dr. Vinish be?
Sir, driver. I would love to drive. तो कम से कम ये है ना कि I'd love to drive. कहीं भी चले जाओ, कुछ भी करो, drive.
Okay, what's your favorite weekend getaway spot?
So from Delhi, I would rather put it this way. It's Haridwar and Rishikesh. Close by, a place that you can go anytime. And even if you want to be a religious thing, can be a religious thing. Or if you want to enjoy rafting and being with friends, you can do that.
Abroad?
ये abroad नहीं sir. India में India is flows. Weekend के तो यहीं पे ठीक है sir. कम यहाँ पे.
If you want to have a favorite vacation spot anywhere in the world?
Closest would be Dubai.
पास का पास है.
नज़दीक है, close by, and I think it has everything possible.
If you could take a day off and do absolutely nothing, what would you do?
So sleep and play guitar. So और गिटार बजाओ बस.
Favorite movie?
Favorite movie? I'd like तारे ज़मीं पर. मुझे बहुत अच्छी लगी थी मूवी. तारे ज़मीं पर was very nice, which I felt.
Your hobby that helps you unwind?
So playing the guitar.
तो सर फिर एक काम करो, थोड़ा सा गिटार ही बजा दो हमारे लिए. एंड गाइज, दिस इज अ वेरी यूनिक एडिशन दैट वी आर डूइंग दिस टाइम. ही लव्स प्लेइंग गिटार, सो वी इनवाइटेड हिम कि आप अपना गिटार लाइए और एक बार हमारे ऑडियंस के लिए गिटार हो जाए.
हसी रात हो
है जैसे, सांसों की जरूरत है जैसे, जिंदगी के लिए हाँ एक सनम चाहिए आशिकी के लिए। जाम की जरूरत है जैसे, जाम की जरूरत है जैसे, बेखुदी के लिए बस एक सनम चाहिए आशिकी के लिए। हाँ एक सनम चाहिए आशिकी के लिए।
Thank you, sir. Thank you, thank you, thank you, thank you.
So, guys, I hope that, the music was absolutely mesmerizing. So, there's no doubt you have not loved it. It was absolutely stunning. So, thank you so much,
Thank
Dr.
you, sir.
Vinish, for being a part of our show, for playing such beautiful music, and for actually making anesthesia the complete branch visible and clear to all of us. Thank you so much.
Sir, thank you for the opportunity. Thank you so much for the opportunity. The pleasure is all mine. Thank you, sir.
And guys, I hope today's episode, I'm sure that you must have loved it. And if you have loved it, please share it with somebody who's thinking of taking anesthesia as a branch, and they will get to know each and every bit about this branch. And before you do that, please do not forget to like, share and subscribe. So subscriber बढ़ाओगे तो और मजा आएगा. And who do you want the next guest to be on our hot seat? Please put down in the comment section. And for me, you can also message them to basically come and enlighten us with their knowledge on our hot seat. I would love to host all the brilliant doctors of our country. Thank you so much. Best of luck and God bless you.